Have you ever paused, perhaps mid-morning with your coffee, and felt a sensation that just wasn't right? A flutter, a pressure, a sudden wave of unease? For many of us, especially as we embrace our vibrant years beyond 60, these moments can be fleetingly dismissed. But what if, in that solitary quiet, your body is desperately trying to send you a life-altering message? What if that seemingly minor discomfort is the opening act of a heart attack, and you're the only one there? It's a chilling thought, isn't it? The idea of facing such a profound health crisis utterly alone. Many seniors living independently and cherishing that freedom might push this possibility to the back of their minds. It won't happen to me, we tell ourselves. But the stark reality is that heart attacks don't wait for a convenient audience. They can strike when we least expect it, and when you're on your own, every single tick of the clock becomes magnified in importance. Are you truly prepared? Do you know, without a shadow of a doubt, the immediate actions that could tip the scales between recovery and a far more tragic outcome? Here on this channel, we're dedicated to your robust health, your vitality, and your empowerment. We often talk about the proactive steps, the nutrition, the exercise, the lifestyle choices that build a strong foundation. But part of true health wisdom is also being prepared for the unexpected. That's why today, we're not just talking about prevention, we're talking about reaction. We're going to walk through critical, life-preserving strategies every single person, especially those over 60, absolutely must know if they suspect a heart attack while alone. These aren't complicated medical procedures. They are straightforward, actionable steps. And please stay with me, because the final piece of advice is one that many overlook, yet it's fundamental not just for survival, but for your continued peace of mind. It's about building a fortress of preparedness around yourself. Let's begin this vital conversation. Now, the competitor's video rightly points out that learning the early signs is crucial. They mention how your body whispers before it shouts, and that's a fair starting point. But let's dig deeper, shall we? Why is this so incredibly vital, particularly for seasoned adults? Most of us have a cinematic version of a heart attack in our minds, don't we? Clutching the chest, dramatic collapse. It's what we've seen. But the truth, especially for individuals over 60, and very often for women at any age, is far more insidious. The early signs can be so subtle, so easily mistaken for indigestion, a touch of fatigue from a restless night, or even just stress. You might feel a peculiar pressure, not necessarily pain, but a fullness or a squeezing sensation in the center of your chest. Does that sound familiar? Maybe you've dismissed it before. This discomfort might ebb and flow, or it could linger. But here's where my perspective broadens. It's not just about recognizing these signs, it's about understanding why they can be so different in seniors. As our bodies mature, our pain perception can change. Nerve pathways might not signal distress with the same intensity they once did. Furthermore, underlying conditions like diabetes can sometimes blunt these typical pain responses. So, discomfort in one or both arms, your back, neck, jaw, or even your stomach could be your heart crying out. Shortness of breath, even if you've just been sitting quietly. A sudden cold, clammy sweat, nausea, or a dizzy spell. Even an overwhelming, inexplicable sense of anxiety or impending doom. These are all pieces of a puzzle. The competitor mentioned Richard, a retired teacher. Imagine someone like him. Perhaps you know a Richard. Active, engaged, but suddenly feeling that off sensation. He thought it was heartburn. How many times have we all done that? This is where we must become hypervigilant. If you have known risk factors, high blood pressure, high cholesterol, diabetes, a family history of heart issues, then you simply don't have the luxury of dismissing these subtle cues. Your first, best defense is to honor what your body is telling you. Are you truly listening, or are you explaining it away? Okay, so you've acknowledged something is seriously wrong. The competitor's advice is spot on. Call 911 immediately. They stress not waiting, not driving yourself, and not calling family first. And I couldn't agree more. But let's explore why this is non-negotiable and what psychological barriers we often face. Every single minute blood flow to your heart is compromised. Heart muscle is dying. It's a stark equation. Time lost equals heart muscle lost. That muscle, once gone, doesn't regenerate. This isn't about being overly dramatic, it's about biological fact. When you dial 911, you're not just calling for a ride, you're activating a highly trained mobile emergency unit. These paramedics can begin life-saving interventions en route, oxygen, crucial medications, even using a defibrillator if your heart enters a lethal rhythm. They essentially bring the emergency room to your doorstep. Now, why the hesitation? Often, it's a desire not to be a bother, or perhaps denial. Maybe it'll pass. Some might think, I'll just call my son/daughter, they can take me. But consider this. What if your condition deteriorates rapidly in your child's car? They aren't equipped to handle it. What if you lose consciousness while trying to drive yourself? You're then endangering yourself and others. The competitor shared Linda's story, who wisely called 911 first. That's the gold standard. My added counsel here is this. Program that emergency number into your phone on speed dial if you haven't already. And even more critically, learn how to use the emergency call feature that bypasses the lock screen on your smartphone. Most phones have this. Take a moment after this video and find it. Practice it. In a moment of panic, fumbling with your phone is the last thing you need. Remember, the emergency services would infinitely prefer a false alarm to a tragic delay. You don't need certainty, you need to act on suspicion. Are you prepared to make that call without a second thought? After that crucial call, the competitor correctly highlights chewing an aspirin, provided you're not allergic and your doctor hasn't advised against it. They explain it helps thin the blood. This is a vital early intervention. But let's unpack the why a bit more and the practicalities. Most heart attacks are triggered by a blood clot lodging in a coronary artery, effectively damming the flow of life-giving blood. Aspirin is an antiplatelet medication. Think of platelets as tiny construction workers in your blood, rushing to form a clot at any sign of vessel injury. In the case of a heart attack, this repair process goes haywire. Aspirin makes these platelets less sticky, slowing down the clot's formation and potentially even helping to break up an existing one. Why chew it? Chewing allows for faster absorption through the lining of your mouth, getting it into your bloodstream much quicker than if you simply swallowed it whole to be processed by your stomach. We're talking minutes versus potentially half an hour or more. The competitor mentioned Joe, who remembered his doctor's advice. This underscores a key point from my perspective. This isn't just about emergency action, it's about proactive conversation with your doctor. Ask them specifically, in the event I suspect a heart attack, is taking aspirin right for me, and what dosage? Don't wait for the crisis. Here's what you should do today. As a practical step, Ensure you have full-strength uncoated aspirin readily available. Not low dose, not enteric coated. Keep it in your nightstand, your kitchen, maybe even a sealed one in your wallet or purse. Check those expiration dates. An expired medication might not be harmful, but it certainly won't be as effective. So, after you've called 911, if appropriate for you, calmly chew that aspirin. It's a small act, but its impact on minimizing heart damage can be profound. Have you had that conversation with your doctor yet? So, you've made the call, you've taken aspirin. What next? The competitor advises sitting or lying down to conserve energy. Absolutely. Your heart is under immense strain. Any extra exertion is like asking a struggling engine to climb a steep hill. But let's refine the how and why. The goal is to reduce your heart's workload. The best position, if you can manage it, is to sit upright, perhaps leaning back slightly with your back supported. A sturdy chair or a sofa is ideal. Why upright? It can make breathing a little easier and can reduce the return of blood to the heart, lessening its burden. Keep your feet flat and arms relaxed. However, heart attacks can often bring on dizziness, lightheadedness, or even fainting. If you feel any of these, then lying down is safer to prevent a fall. The competitor mentions lying on your left side. My additional thought: if you lie down, try to elevate your head slightly with a pillow, if one is easily reachable without exertion. This can also aid breathing and comfort. Lying flat on your back might make breathing feel more labored for some. The story of Alice, who resisted the urge to finish up, is a powerful reminder. That instinct to tidy up, to not cause a fuss, can be dangerously counterproductive. This is not the moment for social graces. It's the moment for self-preservation. Think about your home right now. Where are the safest, easiest places to sit or lie down if you suddenly felt unwell? Pre-identifying these spots can save precious seconds and reduce panic. It's about making your environment work for you in a crisis. This next point from the competitor might seem minor. Unlock your front door if you are able. But in the chaos of an emergency, this small act can be incredibly significant. They tell Paul's story, whose quick thinking to unlock the door saved paramedics valuable time. Think about it from the responder's perspective. They arrive, lights flashing, sirens wailing, focused on reaching you. A locked door is an immediate barrier. Yes, they can force entry, but that takes time, creates noise, can damage your property, and adds a layer of stress to an already fraught situation. If you are physically able to move safely to the door without straining yourself or risking a fall, then unlocking it can shave crucial moments off their access time. Now, let's be realistic. As the competitor also notes, if you are too weak, too dizzy, or in severe pain, do not attempt this. Your immediate safety comes first, but if you can manage it, it's a huge help. My added perspective: what about preventative measures? Consider a key lockbox, the kind real estate agents use. You can place a spare key inside and provide the code to your local emergency dispatch or a trusted neighbor or nearby family member. Some modern smart locks can even be unlocked remotely by a designated contact if you have such a system. Also, ensure your house number is clearly visible from the street, day and night. Are there any obstacles blocking easy access to your front door? These are things you can address before an emergency. Your phone is more than just a calling device in an emergency. The competitor rightly suggests using speakerphone after calling 911 and setting up your phone's medical ID. Let's delve into why these are so powerful. Putting the dispatcher on speakerphone frees your hands and means you don't have to hold the phone to your ear, which can be a strain if you're feeling unwell or short of breath. You can place the phone beside you and focus on staying calm and following instructions. Crucially, if your condition worsens and you become unable to speak, the dispatcher might still be able to hear your breathing or other sounds, giving them vital information about your status. Now, the medical ID feature on smartphones is, in my opinion, one of the most underutilized life-saving tools available. It allows first responders to access critical health information, your name, allergies, medications, pre-existing conditions, emergency contacts, even if your phone is locked. The competitor's story of Susan, whose medical ID alerted paramedics to her penicillin allergy, is a perfect illustration. This isn't just convenient. It can prevent catastrophic medical errors. So here's your homework. Today, take 5 minutes. Go into your phone's health app or settings and fill out that medical ID. Be thorough. List all medications, even over-the-counter ones you take regularly. Include your doctor's contact information, and make sure the setting to show it on the lock screen is enabled. Have you done this yet? If not, why wait for an emergency to wish you had? When a health crisis hits, fear is a natural, almost overwhelming response. The competitor advises slow, controlled breathing. This is profoundly important. Panic triggers an adrenaline surge, which actually puts more strain on your already struggling heart by increasing heart rate and blood pressure. Controlled breathing, sometimes called diaphragmatic or box breathing, acts as an anchor. It helps to calm your nervous system, signaling your body to ease out of that fight or flight mode. While it won't fix the blockage, it can help stabilize your heart rate and blood pressure, making your heart's job a little less taxing while you await help. The technique is simple. Inhale slowly through your nose, hold for a moment. If comfortable, then exhale even more slowly through your mouth. Focus solely on the rhythm of your breath. The competitor mentioned Frank, who used breathing to stay calm. This is a skill you can practice daily, not just for heart attack scenarios, but for any moment of stress or anxiety. The more you practice it when you're well, the more instinctively it will come to you, if, heaven forbid, you ever truly need it. It's a tool you always have with you. Can you commit to practicing this for just a few minutes each day? And this brings us to what I believe is the cornerstone, the step that underpins all others. The competitor calls it, prepare today so you can act tomorrow. I call it building your personal fortress of readiness. This isn't about dwelling on fear, it's about empowering yourself with foresight and practical preparation. A heart attack is often unpredictable, but your response doesn't have to be. So what does this comprehensive preparation look like? Aspirin strategy. As discussed, appropriate aspirin in easily accessible locations. Vital information list. A clearly printed list of all your medications, any allergies, your doctor's names and numbers, and key emergency contacts. Keep copies in your wallet, by your phone, and perhaps on your fridge. Medical ID activated. Your smartphone set up as your silent advocate. Home readiness. Your address clearly visible, entryways clear, and perhaps that lockbox system in place. Knowledge and practice. Familiarity with heart attack symptoms and practiced calm breathing techniques. But it goes beyond just your preparation. Talk to your family. Share this video's information. Let them know what your plan is. If you were to call them sounding distressed, what should they do? The story of Maria, who had watched a similar video and calmly followed the steps, is what we're aiming for. Informed action, not panicked reaction. This preparation does more than just equip you for a crisis. It provides profound peace of mind. Knowing you've done everything you can to protect yourself allows you to live more freely, more confidently. This isn't just about surviving, it's about thriving with awareness. So let's quickly revisit these vital actions. 1. Decipher your body's often subtle signals. 2. Call 911 without a moment's hesitation. 3. Chew aspirin to fight the clot. 4. Sit or lie down wisely to conserve precious heart energy. 5. Unlock your door if safe, to smooth the path for help. 6. Use speakerphone and medical ID. Let your phone work for you. 7. Breathe slowly and deliberately to calm body and mind. 8. And most importantly, prepare today. Build that fortress of readiness. You don't need to overhaul everything at once. Perhaps start by checking your aspirin supply. Maybe take those 5 minutes to set up your medical ID after this video. Or practice that calming breath right now. Each small step you take fortifies your defenses. If you found this information valuable, if it sparked even one idea for how you can be better prepared, please let me know in the comments below. Which step resonated most with you? What's one action you plan to take this week? Sharing your intentions can inspire others in our community. And of course, if this could help someone you care about, a parent, a spouse, a friend, please share it with them. Let's have these crucial conversations. Thank you for investing this time in your health and safety. Stay informed, stay prepared, and live well. We'll see you in the next video.